So I'm here to talk about feet tonight. My name is Brenda Miller. I own Core Physical Therapy, which is right down on South Main. I opened almost 2 years ago. It's been close to 2 years. And Morgan in the back is one of the physical therapists at my facility. She's been there almost a year. I've had about 30 years of practice, so a lot of experience. So I'm here to talk about feet today and how you can kind of get to know what type of feet you have and what may be the best shoe for you, and just to be a little bit more aware of what your body is made of. All right, maybe not. Okay, so I'm going to go over just a brief introduction on the anatomy of the foot and ankle. I'm going to go over what I would term posture, what is pronation and what is supination. I'm sure you've heard those terms before. What is normal walking? And then I'm going to go over what happens if you pronate too much or you supinate too much, and then how to pick the right shoe. And then when I'm done, Morgan and I are both very willing to look at anybody's shoes, look at your feet, look at how you walk. So if you want to just stay after when you're done and just get an idea of what you should be wearing and what type of foot you have, we can talk to you about that. Okay? So I just wanted, on that top picture, I wanted you to just appreciate all those ligaments. So all of these little things, and there's a lot more that are in the forefoot that aren't even on this picture. But I wanted you to just get an idea of how many ligaments are there. So ligaments attach bone to bone. Some people's ligaments are longer than other people's ligaments. So if you have ligaments that are pretty long, then those people tend to be the really flexible people. We call them hypermobile. They're the ones that can put their foot behind their head, or they call themselves double jointed. They can really overextend limbs more than they should. Those people tend to have a lot more problems because they have to rely on other things to give them stability because their ligaments aren't really giving them that stability. So people will get through it a little bit later, but people that are really rigid feet, oftentimes have really short ligaments. And then other people that have really flexible feet may have longer ligaments. So the bottom picture shows the Achilles tendon right here, and that tends to cause problems in a lot of people. And there's a lot of reasons why you can have this problem, but when people have pain on the back of their heel, it's usually right above their heel bone. That's often Achilles tendonitis. It usually occurs right about here, but it can also occur down right at the very bottom where it inserts into the heel. There's a lot of different reasons why this happens. Some because your calves may be tight, you may be weak, or I see this a lot with people that pronate, and we'll go over what that is a little bit later. The bottom is also probably something you've heard, the plantar fascia. And the plantar fascia is not a contractile tissue. So it can get pulled and it can get stretched, but it doesn't actually stretch. It'll just get, this attachment right here will get pulled from the bone. So if that foot, it's supposed to protect that arch. So if that arch keeps flattening out and flattening out, what it's going to do is tug on this plantar fascia, and typically it'll start to pull it away from the bone right there. And people will develop bone spurs possibly, but it's not the bone spur that's causing the problem, it's the irritation right where that inserts at the heel that causes the issue. So again, it can be due to the way you walk or what type of foot structure you have or your flexibility. There's a lot of different reasons for it. So when we evaluate posture, I look at the whole picture, not just the foot and ankle. We're going to be just going over foot and ankle today, but when I look at somebody, I'm going to look and see what do their hips look like, or is their pelvis level, because that can really affect how you walk. So I look at, is their pelvis level? Is it rotated? Do their knees face in and turn each other? Do they have bowed legs? Do they have knock knees? You know, there's a lot of different types of structure, and some of that's going to dictate how their feet work. Okay, so I'm not only looking at this down below part here, but I'm going to look at the whole body. Okay, but for today's lecture, we're going really over from the from the knee down. So this picture right here is considered a neutral ankle. So if you look at this model, this bone is fitting nicely in between these two bones. Okay, so that's considered neutral. You're not pronating and you're not supinating. You're in a neutral position. You can see that blue line right here. It's kind of pretty in line with the heel. So that is ideal. That's what we want, but most people aren't like that. Over here, you're going to see what's called supination. So supination is when you are weight bearing a lot on the outside of your foot. So if you're standing there and you feel a lot of weight on the outside of your feet, you have quite a big arch there, then you may be standing in supination. It doesn't necessarily mean you're a supinator. It just means you're standing in supination. Okay? This person, on the other hand, is a pronator. So when you look down at your feet, you shouldn't be able to see this part of your heel. This person tends to have a flatter foot, a more flexible foot, and they're going to roll in a lot, but they don't always have to be flat-footed. So it just depends on how they're walking and how they're functioning as to whether it is a problem or not. So back to pronation. It's normal. Everybody should pronate. So when you walk, there are certain times during that walking cycle that you should be pronating. Okay? What happens when you pronate? Those ligaments that I showed you, they kind of get to their stretched point. Those bones loosen and you get a very flexible foot. Okay? So you need this because it provides shock absorption. If you don't have any pronation, then you're going to have a very rigid landing and no shock absorption. So the problem is, okay. So if this person pronates too much or too little or at the wrong time when they're walking, that's when it's a problem. But normal pronation is not a problem. Now this person is pronating quite a bit, so it probably is a problem, but just so you understand that everybody should pronate and everybody should supinate if they're walking ideally. And this is the opposite. So this is the supination. This is when they're weight bearing more on the outside of their foot. This is very rigid. Those bones are all snug together and you're getting a lot of stability, but you're not really getting any shock absorption. So you do want to have supination when you're walking, but you don't want to have it the whole time. Because if you supinate the whole time, then you're not getting any shock absorption through your foot. And it's a very rigid lever, can cause a lot of problems. So normal walking. As I said, you should pronate and supinate every time you take a step. Okay, so when you heel strike, if you're heel striking, you should land on the heel, on the outside of the heel. That's ideal. And that is supination. So when you're in that supination, it's rigid. You're landing on a rigid lever. You need that stability. But immediately when you start to bring your foot down, you're going to start to pronate. You're going to start to roll in and get some flexibility because you need some shock absorption. You don't want that jarring through your body. And then as you continue on, you're going to re-supinate when you're ready to push off because, again, you need a rigid lever. You don't want to push off a pronated foot because that's really flexible and you're not getting any stability. Okay, so that's ideal. The problem is if you do it too much or do it too little or do it at the wrong time, that it becomes an issue. So here's somebody that is an overpronator. So you can see, obviously, whoops, wrong button. Okay, you can see this angle with this angle, not good, right? You're not getting that alignment that you should have. So this person may, when they sit on a chair and lift their foot up, they may have an arch. So just because you have an arch doesn't mean you're not a pronator. Okay, if you stand on your feet and you're immediately rolling in, then there's a very good chance you're an overpronator. So this person's feet are very flexible. This person needs some stability because they're too flexible. And the reason that this is a problem is because all of these muscles here, the tendons over here on the inside of their foot, they have to work so much more because they're rolling in so much more. So all of those muscles are working just a little bit harder with every single step you take. And that's how a lot of tendinitis is developed. So this person is going to need some kind of stability. There are other reasons why you can be a pronator, and it doesn't, and again, back up the chain. So if they're really weak hips, you don't have good glute muscles, then if you don't have good glute muscles and you start to bend, you're going to bend at your knees and you can pronate at your feet, right? So if that happens, sometimes they just need some strengthening of their glutes in order to improve that pronation. But a lot of times, they're going to need something to help control that. So, problems that I see with pronators: plantar fasciitis, Achilles tendonitis, other tendinitises around the foot and ankle, knee pain, back pain, hip pain, a lot of issues from this problem. So this is what they need, oftentimes. Not all the time, but this is what they often need. So you can see on the picture on the right, there's that angle that we don't like. And then when they get in the orthotic, you can see they're much straighter. So I brought a couple. There's a lot of different types of inserts that you can have, but the point of the insert is there's a little lift on that inside. So now when they're trying to pronate in, this is going to stop them, so they're not going to roll in as much. So it's going to take a lot of that stress off those muscles that help lower that foot. It's going to release a lot of that stress on those muscles. So there are some that are 3/4 length, there are some that are full length. I really like, if you like running shoes, I really like Runabout Sports. They've got some super feet there that are very rigid and go the full length. Some people want to wear them in dress shoes and they can't wear those because the toe box isn't big enough, so they may want something like this. Or I even have something that's a little bit more cushiony, so maybe if somebody just needs a little bit of support, then they can use something like that. So it really depends on the severity of the pronation, what activities they're doing, how supportive their shoes are, as to what you're going to need in them. Any questions so far? That makes sense, kind of? Okay, this is the opposite. This is my rigid foot person. They walk on the outside of their feet. They often have very high arches, whether they're standing or they're sitting. They can't pronate. They just can't roll in. So their feet are really rigid. Those ligaments are really tight. Their muscles are really tight. They usually have really tight calves. So this can create a whole different set of problems. Sprained ankles, you can see how that could happen. So if they put something in their shoe to just give them support because they like the feeling of something under their arch, they're more prone to turn their ankles, so they can have problems with ankle sprains. A lot of like jarring injuries, shin splints, back pain, hip pain, knee pain, a lot of foot problems just because they're not getting any shock absorption. So this person needs cushion. You don't want to put them in a firm shoe. You don't want to put them in something that has a lot of support. So if you want to try to figure out what type of foot you have, there's some little tests that you can do. So the bottom, well, let's start from the first one here. So this is kind of an ideal foot, right? So they're not, I'm sorry, this one's the ideal foot. Okay, so let's start with supination. So here's somebody that supinates too much. That person we just saw, they're rolling on the outside of their feet a lot. So if you look at their shoes, if they've had their shoes for a while, what they're going to do is they're going to wear on their heel, which is great, that's what we want. But they're also going to wear on the outside of the forefoot. So once their shoes wear and they're a supinator, what you're going to notice is this is their wear pattern on their shoes. If they get out of the shower and put their foot down on a mat, you're not going to see much in the arch. It's so high, you're not going to get any imprint there. So that's one kind of easy way that you can try to figure it out yourself. This is more of a neutral person. This is kind of what you want it to look like. You want a little bit of air here, but you do want some contact in the middle. This is what you want for the wear of the shoe. So you want it on the outside of your heel, and then you want it more in the whole foot, kind of middle of the foot when you're pushing off. These two, I would have to say this might be a little bit wide for a mild overpronation, but this person's going to have a flatter foot, so there's going to be more of an imprint. And the difference is they're going to wear on the heel properly, but they're not going to wear on the forefoot properly. So they're going to roll off their big toe. A big problem with these two is bunions. So if people have bunions and they have that migration of that big toe starting to go toward that second toe, a lot of times it's because they're rolling off on that big toe and it's causing that shearing. So to try to prevent your bunion from getting worse. You can't necessarily get it better, but to prevent it from getting worse, you definitely want to put some type of insert in your shoe so that you're not pressing so hard on that big toe. And then the last one, these really heavy pronators, they have no arch whatsoever. It's just one big flat foot, and they weight bear only on the medial side of their shoe. So it's kind of an easy way to determine what kind of foot you have.
Can I ask a question?
Yep.
Does it change with age?
It sure does. Yes, people can get a little bit, they tend to get a little bit more pronated with age, but that's not always the case. They can, once people have rigid feet, I mean, I've seen a lot of people that are older that still have pretty rigid feet even when they're older, but you do tend to, pregnancy tends to make their feet bigger and you can pronate a little bit more. There's a lot of different things that can cause changes, but so there are, you know, even when people get custom orthotics, and one of the things, I hardly ever make custom orthotics because I don't really feel like they're necessary. Unless somebody has a very different or severe type of problem in their foot, over-the-counter inserts have really been proven to be almost, I mean, just as successful for relieving whatever problems you have than getting custom. Now there are a few. They may have one foot that's really different from another, or one foot that's pretty severe, or both feet that are pretty severe that will be appropriate for custom, but it's not that common. I think I've made 2 pairs since I've been open here in 2 years. Okay, so these are kind of related to running shoes. However, you can use all of this information for any type of shoe that you want to get. So what I'm going to do is I'm going to go over the different types of shoes. If you were going to a running store, then you would be able to, they would take you, well, they may not take you through these shoes, but they should know that there's 3 different types of shoes that you can get. Okay, if you go out to get a pair of dress shoes, or to get a pair of flat shoes, or to get something else that's not a running shoe, you can still apply the same principles. So I'm going to go over what a neutral shoe is first. So a neutral shoe, here's an example of a neutral shoe. This is a neutral shoe. You can just bend it up. Okay. Put that down. So a neutral shoe is one made for somebody who has an ideal foot. So, or it can be made for somebody who's a supinator, somebody that has a rigid foot. But this would have to have a lot of cushion in it for somebody that has a rigid foot to be happy in. Okay, so supinators, people that walk on the outside of their feet, they're going to want something that's a neutral shoe, something that has a lot of cushion. They may even want to put an extra cushion inside the shoe. This doesn't really have any support at all. So if you're a pronator, you don't really want these. If you're having problems, if you're a pretty neutral foot and you pronate just adequately, not excessively, then this would be fine for you. A lot of runners use this. It's very, very light. They like the fact that it's really light, but it's not going to really offer much support if you have a problem with pronation. The next one is the stability shoe. So that's more for the people that just pronate maybe a little bit too much, or maybe a little bit more than too much. So these should have, and there's a wide range. So you've got your low end stability where there's just a little bit of support, and then you've got your higher end stability, which you're going to have a lot more support. So things I tell patients to look for when they pronate too much is I first tell them, look at the heel counter and press it in. And does it lock your heel in? And so if you look at this one, nothing's happening, right? So it's not locking the heel in at all. This one, yes, it's going to lock that heel in, so if you lock the heel in, it's going to prevent your foot from rolling in so much. The next thing I like to see is that it doesn't break in the middle, because your foot shouldn't be breaking in the middle. When you're walking, you walk over where your toes are, right? You don't walk in the middle of your foot. So I want the shoe to break where the toes break. So I'll just go around and I'll push all these shoes, and I'll say, all right, where does this break? And if you push hard enough, you can start to break the middle, because think it's all your weight on here, and I'm just using my hand. So this one's pretty stable shoe, right? It's only breaking where my toes are. Same thing with this one. So some things that you can see with this, so this heel counter isn't quite as strong as the last heel counter, But the other thing you want to look for, and you'll usually see in a stability shoe, is they're usually some kind of plastic piece or something that's harder here. The neutral shoes have really, they have really cushiony, rubbery, kind of softer soles, right? And these shoes have more hard plastic, so that's going to give it a little extra stability. They usually have a little bit straighter midfoot, and if they do have a cutout, then you'll see there's a little plastic in there to try to counteract, because they're trying to take away some of the weight. Runners don't like to wear shoes that are heavy, so they're trying to take out some of the weight, but it compromises some of the stability. So then they'll just add some kind of plastic or something there to give it a little bit more stability.
So if you have a neutral foot, how does that impact if you wear a stability shoe? Like, is it not enough cushion, or is it too hard? I'm trying to figure out what you're saying.
You can wear, if you have a neutral foot, you can usually get away with this. You don't usually want, you're pretty safe to wear most things. You wouldn't really want to wear a motion control shoe, which I'll get into next, because that's overkill. But people that have a neutral foot should have no problem wearing a stability shoe. The motion control shoes, they used to look really blocky. I mean, you couldn't tell left from right. And now they've come a long way, and now they look like normal shoes. And sometimes you can't tell from a stability shoe. I don't have one with me, but they tend to be a little bit more stable. They're much heavier. So those are for those people that are really heavy pronators, and sometimes overweight people that are runners, or they're really strong heel strikers. You're going to want to get them in a shoe that's got a lot of stability, because they're going to cause a lot of breakdown due to their size and the fact that they pronate too much. There's not a lot of motion control shoes out there, but usually some of the higher end running shoes will have at least one option where you can go for a motion control shoe. So, does that make sense? So, any questions?
So I guess you could have one foot that pronates and one that doesn't, right? Because I've been
Sure
called
can.
a windswept.
You sure could, and sometimes I see if somebody has a longer leg on one side, oftentimes that leg will pronate too, because that's making that leg shorter, and that doesn't always happen, but that's why you never want to just look at the feet. You want to look at the whole person and see, is there anything else that's going on?
So then ideally you might have two pair of shoes.
You might.
Yeah.
Well, so this pair of shoes is for somebody that has two very different feet. And you can see they had to get two different sizes. And he's a big supinator because he had to have Achilles lengthening when he was younger. So he's a big supinator. You can kind of see just by looking at that shoe that he just kind of rolls out on that. So you can, what I also will tell people is if you look at the back of the shoe and you bisect it with a pen or something, it should be pretty perpendicular to the ground. So for really heavy pronators, what you'll see is that the shoe is like that. And so if I see somebody that comes in and they're a big pronator, and I'll say, well, you need to get some inserts. If their shoes look like this, I'll say, you need to get some new shoes and then inserts, because they can put the inserts in there and it'll give them a little bit more stability, but they need to start over. If they haven't broken them down yet and they're not as rigid as I want, then get a rigid insert and more rigid insert, and you can